Sean Dilweg is the Commissioner of Insurance for the state of Wisconsin. Prior to his appointment in 2007, Mr. Dilweg served as the Executive Assistant to the Secretary of the Wisconsin Department of Administration from 2003 to 2006. Previously, he worked as Director of Policy Analysis at SE Consulting Group, a major Madison consulting and lobbying firm, from 2000 to 2003. He holds a Master's in Public Administration from the University of Wisconsin and a Bachelor's in English from Lawrence University in Appleton.
Thank you, Chairman Andrews, Ranking Member Klein, and members of the committee. My name is Sean Dilweg. I am the Insurance Commissioner from the state of Wisconsin. Thank you for inviting me to testify this afternoon on the Paul Wellstone Mental Health and Addiction Equity Act of 2007. Today, I will speak to the importance of parity legislation and highlight the importance of H.R. 1424 in addressing unequal coverage limitations on mental health services. In addition, I will express my concern with preemption language included in the amended Senate Mental Health Parity Bill, which leaves Wisconsin's mental health mandate and laws in other states vulnerable to court interpretation. There are currently 46 states with laws requiring some level of mental health coverage and 27 states with full parity laws. I have had discussions with other state commissioners who are strongly concerned with the Senate language. Individuals diagnosed with a mental illness are too often limited in their ability to access treatment due to insufficient insurance coverage. Such treatment limitations force this population to look to their own finances or public programs as means to cover expenses. In the worst cases, people forgo services altogether, given the debilitating nature of many mental illnesses. Individuals find they cannot maintain employment, health conditions related to mental health illness go untreated, and people generally find themselves unable to maintain the quality of life most of us enjoy. The House bill will greatly improve access to mental health services by ensuring individuals the same level of insurance coverage for their mental health needs as would be available for their treatment of other medical conditions. In Wisconsin, group health insurers providing coverage for inpatient hospital treatment, outpatient treatment, or both must also provide coverage for mental health and alcohol and other drug abuse services. This means insurance companies selling health insurance coverage to employers in Wisconsin must include coverage for mental health-related care. State law requires a minimum of $7,000 in coverage be provided for these services, but also allows plans to limit benefits to the statutory amount. These coverage requirements do not go far, especially for those who have a severe mental illness or dual diagnosis. This has been in place for 30 years. I have seen democratically controlled Senate, House, and Governor in our body, and also Republican controlled, and we have never been able to change this to full parity. I welcome the fact that you are pursuing full parity under the preempted ERISA plans. The gaps in coverage across the nation with regard to mental health services are vast. There are also disparities between what group health insurers and the self-insured are required to pay within states across the nation. Some employers have been known to move to a self-insured plan specifically to avoid the state mandates. Once again, I welcome the federal mental health parity law and look forward to action on this bill. I also commend Representatives Kennedy and Ramstad in their efforts to improve coverage of mental health benefits in private health insurance while ensuring that federal standards serve as a floor, not a ceiling. This is consistent with the preemption language in the Health Insurance Portability and Accountability Act of 1996. HIPAA's portability and access provisions affecting private health coverage has been a model for how federal and state health coverage reforms can work together, with states having the flexibility to supplement federal standards to better protect consumers when necessary. In moving forward towards equity and coverage for mental health services, it is important to maintain the recognition that state policymakers may determine it necessary to have a stronger set of standards to ensure the protection of patients in state-regulated health insurance policies. Under the Senate version, it would be very problematic for Wisconsin and other states if the House were to move in the direction of the Senate with regard to preemption. Senate version preempts any state mental health parity standard or requirement which differs from the mental health parity standards required in the bill. Wisconsin and other states are struggling to predict how the preemption language may impact our current parity laws. Concerns have been expressed on the impact to mental health mandates in states including Washington, Vermont, Oregon, Connecticut, I just spoke with California this morning, Montana, Maryland, and Nevada. In states such as Wisconsin, California, Maryland, and Montana, where the mental health parity laws apply generally to health insurance coverage, and there is no distinction between small and large group coverage, it is questionable whether courts will uphold these laws as they apply to individual and small group policies if challenged under ERISA. As a result, the legislative intent in the bill to save state individual and small group coverage from preemption may not be accomplished. Washington and Connecticut have a mandated benefit and require parity with medical coverage. If these mandated benefits are preempted by unclear language of the manager's amendment, carriers would not be required to provide mental health benefits, leaving consumers at risk of losing coverage they currently rely on. In conclusion, as the insurance commissioner charged with protecting consumers, I have a responsibility to bring to light issues that may put consumers at risk. The intent of the House and Senate bill is laudable. However, the Senate preemption language opens a door for an all-or-nothing situation in Wisconsin and other states with similar mental health mandates. I have raised several preemption questions. There are others that may come to light as other states more carefully review the proposed language. These could be open to interpretation and based on new ERISA-related litigation that will come at a high price tag for people who may lose benefits while waiting years for courts to determine if state laws are preempted. The preemption language included in the House is clear and will preserve and strengthen Wisconsin and other states' mental health mandates, as well as many mental health parity laws across the nation. Thank you again for this opportunity to